Hey guys, today we're making another video interviewing a surgeon. So, hello Miss Ali.
Hello, how are you doing?
I'm good. So, what's the hardest or most complicated surgery you have ever done?
So at the moment, I'm still in training, so I do a lot of assisting in surgeries, but I've been in some really interesting and really difficult cases. So I think the most complicated one that I've seen is a poor lady who had their stomach, unfortunately, was dead because it got caught up inside their chest. And so that was pretty complicated because we had to pull the stomach out of the chest and then take it out.
Thank you.
What do you do before you start a surgery?
What do you do? So you go and see the patient and you talk to them and you make sure that they're happy with what's going to happen and they understand what you're going to do and why you're doing it. And then you look through the case notes, look through their investigations and any imaging that they have. And then kind of gather the team around and make sure that everyone, from the anaesthetists who put the patient to sleep to all of the different nurses and different practitioners in theatre are happy with the plan. And that's just to help us make sure that everything goes straightforwardly for the patient and everything's as smooth as it can be and everyone knows what's happening.
Okay. What are your qualifications?
So a GCSE, I just did sort of standard kind of GCSE, so science, maths, English, Spanish, art, physics, things like that. And then for A-level, I did 4 A-levels. So all the sciences, biology, chemistry, physics, and then I decided to do art as well. Then I went to medical school for 5 years, and I did another intercalated degree in surgery and anaesthetics at a different medical school for a year. And then since graduating from medicine, I've done some of my postgraduate exams, so 2 postgraduate examinations to help me on the way. So it's a lot of studying, but it is worth it in the end.
What are some of the positives and negatives being a surgeon?
So let's start with the bad things first. Bad things are that it is pretty busy and it takes, definitely a toll on your personal life. You are busy, you spend a lot of time studying, a lot of time doing research or things that take you away from your family and friends. But to be honest, actually, we wouldn't do it if it wasn't as rewarding as it is. And that's seeing a patient come in through the doors, really sick, really unwell, and actually something that you've done, something you've personally done, has helped them get better. So that's probably the most rewarding thing about it.
What's the worst thing?
Hi guys, welcome back to my YouTube channel, and today we're going to be eating
Hey,
popcorn.
What's this popcorn, man?
Popcorn.
Probably getting covered in poo every so often. It's probably the worst thing. And yeah, the long hours and having to miss things with family and friends.
What's the most stressful thing about your job?
Sick patients, because actually then you have to see someone and make a decision what you're going to do. And yes, you're very supported by your senior colleagues, but sometimes you just have to make a decision and start managing the patient.
Okay, so the next question is, what are some positive? What are you best at in your job, and what are you worst at in your job?
Oh, what am I best at in my job? I think probably, so medicine's one big team sport really. So I think the thing I'm probably best at is making sure that, I get on well with the team and know how to work well within the team. In terms of what I'm worst at, probably I'm a bit bossy. So maybe telling people what to do.
Okay. What are like some of the potential risks and complications in your job?
Risks and complications. Do you mean sort of to me or to the patients?
To the patients.
To the patient. So I think, obviously surgery is very invasive. You're actually doing something to someone with your own hands. So I think probably the risks and complications that you do either the wrong operation or that you're not doing the operation for the right reason. So you think that actually the patient has X wrong with them, but actually, and you do an operation to sort out X, but actually it's Y. And so I think it's always that balance of doing what you think is right for the patient, but also balancing it out with the risk of surgery, which could possibly be very harmful and very dangerous for them.
If there's anything you can change in your career path, what would it be?
So you have to move around quite a lot as a doctor. So you don't always have the same job location from your first few years in training to the middle years of training to your later years of training. So I think if I could change anything, it would actually being able to sort of stay in one place and not constantly having to move jobs and locations every sort of few months to every year.
Okay, what made you become a surgeon?
So I was really fortunate, and I went to India when I was a lot younger, and I was interested in medicine then. So I was able to see some open heart surgery. And I remember going to go see a patient at sort of 4 o'clock in the morning, because that's the only time there that they could
Sorry, Miss Ali, could you explain what open heart surgery is, please?
So essentially, this patient had a hole in their heart, and they needed to have a big operation where they kind of cut the patient all the way up and down the chest, and open up the chest, and try and fix the hole in the heart. And it's really common, particularly in the developing world. But unfortunately, that means that, you know, as you're growing up, you need oxygen to breathe, don't you? And you need your heart to function well. And so the patient really wasn't doing very well before the surgery. They kind of looked really blue. They were really breathless. They were really uncomfortable. And then I saw them, we did the operation, and then I saw them after the surgery, and they were fixed, and it was amazing. And I'd never seen such an amazing sort of change in a person from, you know, from a few hours where even just lying in a bed, they were comfortable. And it's something that you take for granted completely. But for, you know, you can really sort of help people and change things and make a difference for them. So I kind of always knew that that's what I wanted to do, and wanted to be able to have that impact on people and help people like that.
What type of patients do you get?
So at the moment, I'm working in Oxford on the surgical emergency unit. So we get generally patients who come in with abdominal pain. So sick patients who have a surgical emergency. So things like appendicitis, or a bit of bowels gotten twisted and they're all blocked up, or a bit of bowels popped. So normally they're quite unwell and they require operations to sort them out. And we get a little bit of trauma as well, but nowhere near what you guys in London would get.
Can you explain the difference between, like, so what's trauma versus what's emergency?
So trauma is still part of emergency surgery, but tends to be more patients who've had road traffic accidents, or there have been stabbings or shootings, and they have wounds which kind of go into their stomach, and you worry about all of the organs like the liver and the bowel getting injured because of that.
Have you ever lost a life or someone died?
I mean, you know, it does happen. And as a team, you know, we do have a couple of patients that pass away every week, despite, you know, our best efforts, or they come in and they're too poorly for us to, you know, operate on. But yeah, we do, absolutely. And it is still sad, and it is still upsetting.
Hey!
What's the grossest, most disgusting thing you have ever seen as a surgeon?
So this is not here on the SEU, but in a different place. I once saw a poor lady who had been run over by a train, and unfortunately all of her arms and legs have been cut off. So that was really bad. That was pretty gross. Not for the faint-hearted, certainly.
What was the most favorite thing about? What's your most favorite thing about this being a surgeon?
My favorite thing about it,
Yeah.
operating is pretty cool, and it's really satisfying because we study quite a lot in medicine, and initially when you start, it just all looks like a complete mess. You know, you've got lots of guts which are kind of twisted around each other, and you don't really understand what's going where and how everything is connected. But then eventually you start to understand what's happening. And I think my favorite thing is probably that process of being able to look inside someone and trying to figure out and actually understanding what's going on and what you need to do next.
One more question. What's
Mhm.
the longest surgery you ever performed?
So the longest one I've ever been in was another open heart surgery, and it took 8 hours. So we had to open up someone's chest and replace 2 of the valves in their heart because they were leaking and not working well. And that took 8 hours, which was a long time. Definitely, you know, I was ready for the loo after that, definitely.
Can I ask one more question? Okay, have you ever like used machinery to help, like to make your hands more steady and stuff?
To make your hands so really good question. And actually sometimes some specialties do use robots to get into deep dark places, like in people's hips and their pelvis, where it's really difficult to get in with your hand. I mean, so that is definitely one thing that people do use. Other types of technology that you use are, instead of making a big open cut in someone's, you know, chest or their tummy, we use keyhole surgery. So you put in a camera and then you put in really sort of long instruments that let you kind of do what you want to do. So not quite robots. So sometimes we use robots, and then sometimes we use just, you know, other surgical tools as well. But lots of technology.
Can I ask a question as well? What's the most gruesome body part you have seen?
The most recent body part I've seen.
Gruesome.
Oh, gruesome body parts. I think probably my limb, which wasn't attached to someone. I don't really like that. It makes me feel a bit sick, a bit squeamish.
What limb was
The
it?
last.
Well, it was so recently when I was on at the weekend, there was some poor lady had been hit by a car, and her leg was sort of just dangling off, and all the skin had come off, and the bone had broken, and you know all the muscles were kind of flapping around. So that was, you know, not particularly pleasant.
This is the last question from me.
Mhm.
Have you seen someone's leg that's been like snapped in half?
Yeah, I have.
What is
So
it?
not so you still have muscles and things which will keep it on, but yeah, when the bone's completely broken and it's just bendy like spaghetti.
So somebody thinking to become a surgeon in the future, because like at the moment we're making a YouTube channel for the young people at School 21, but hopefully in other schools as well. Like, what kind of things do they need to do to prepare to become a surgeon?
Okay. So I think first step is thinking about it and thinking that it's something that you might want to do. And generally, if you enjoy helping people and you enjoy being practical with your hands and you enjoy sort of problem solving in more of a, you know, doing things sort of way rather than just thinking about problems, then, you know, being a surgeon could definitely be something that could be suited to you. I would say, you know, medicine is very academic. So studying and making sure that you do the right subjects as well. So generally sciences are what is the most important thing in terms of A levels and GCSE. And then also getting, you know, experience, like either experience in a GP practice or in hospital, or, you know, even looking up places like the Royal College of Surgeons, which have events for aspiring, you know, surgeons and medical students and things like that to go along to.
Okay, me. Have you ever performed brain surgery?
No, I haven't. One of my housemates is a brain surgeon, and he tells me that it's very cool, but I never have. No.
Do you think you could talk a little bit about the distinction between surgery and medicine? Because I think most people would probably think of them as the same thing, but I know they're
Yeah.
different, right?
So we all sort of start out as the same. We all go to medical school and we all do the same sort of general training for the first 1 or 2 years after we graduate. And then you sort of decide that actually you probably prefer a different type of thing. So my medical colleagues tend to focus more on problems that they can solve with medications or interventions, whereas in surgery we tend to focus more on problems that we can fix by, very roughly saying cutting out a bit of someone or joining up a bit of someone.
Awesome, thank you. And then one last question from me. In terms of getting work experience, what's the best way for young people at school to go about doing that?
So I would say, first of all, starting with your GP and seeing if you can shadow anyone, but also all hospitals will normally have someone who deals with volunteering. And that person, you just need to keep on emailing them or writing to them. Like, I think I remember the person that I had to email to get work experience. I think I had her mobile phone number. I think I had her home phone number, her email address. And you basically just have to keep on trying to get into contact and show that you're interested in. But even things like sort of trying to get experience by working in a residential home or a care home, or going in for a little, a day or so, a week, can be really valuable and useful just to get you into that sort of healthcare environment as well.
Okay, that's great. Thank you, Miss Ali. Okay, I'm going to take that silence as a no. I'm sure, Miss Ali, if we have more questions, we can email you.
Absolutely.
Yeah, awesome.
Well, thank you for speaking to me.
Yeah, thank you so much.
Let me know if you have any other questions.
Thank you.
Thank
Bye.
you. Bye.
Bye.
Bye.